It seems like every day the Ebola outbreak just keeps widening, even making its way to the United States, where a patient in Dallas recently died. The director of the Centers of Disease Control and Prevention, Tom Frieden, says, "In the 30 years I've been working in public health, the only thing like this has been AIDS." And people are taking precautions. For instance, take this shop that sells particle masks. The owner says he can't keep enough of them in stock. In 2 days alone, he sold 2,000 masks.
But efforts are underway to try to get a handle on Ebola. Take a look at this robot. That flashing you see is coming from him. Health workers wheel this guy into a room and it pulses UV light that's 25 times brighter than the sun. Now basically the light zaps bacteria and viruses in about 10 to 15 minutes. The robot, which costs more than $100,000, is being used at more than 250 locations across the country. It's being called the future of Ebola fighting.
So let's take a closer look at the future. Is it possible that maybe one day soon the Ebola virus will show up here on Delmarva? Well, joining us today to tell us what we need to know when it comes to Ebola and what precautionary measures are already being taken on Delmarva is Olivia Butler, who's the Communicable Disease and Immunization Supervisor with the WICOMICO County Health Department. Thank you so much.
You're welcome.
For coming in today. Let me ask you right off the bat, is there an Ebola vaccine?
No, there's not an Ebola vaccine or treatment currently. The FDA is working on vaccines and treatments, but right now they're experimental and they haven't been tested yet to see if they're safe or effective.
So there's been something they've been working on?
Yes.
Do you think that maybe they're speeding up their efforts because of what's going on?
I think maybe what they're trying to do is have something in the works maybe by September.
Yeah.
To get that going, but it still needs to be tested.
So it didn't take them by surprise.
So should we be worried?
The people that need to be, that are most at risk are the healthcare workers that are caring for patients that are ill with Ebola, and then their family and close friends that are in close contact or taking care of sick people. They are the ones that are at highest risk for being exposed to it. Right here we're conducting surveillance and that adds a layer of protection and assessing if somebody may be at risk.
When you say surveillance, what is that? How does that work?
Just assessing if there's a patient that presents somewhere that the healthcare provider is worried about. There are questions that they can ask about travel history, symptoms, and just if they find somebody that they think that they have questions about, then they would contact local health department, state health department.
Okay. So a couple months back, we had a couple scientists who contracted Ebola. He came to the United States. They were treated and they recovered. But then we hear about this man in Texas who died. Why did that happen?
Well, considering what we know about the case fatality rate with the Ebola, it's not surprising that people will die from it. The experiments or the treatments are experimental at this point, so right now they're just basically treating symptoms and each individual responds differently to those treatments.
So how is it spread?
It's spread through direct contact with blood and body fluids of a person that's infected.
Okay.
So it can enter your body through broken skin or your eyes, nose, and mouth. Healthcare workers can be contaminated by syringes or needles. It is not spread through air, water, or food.
Oh, okay.
So it's not like the common cold where you can be in the same room with someone.
Correct.
Okay, so what about symptoms that we should be looking for?
Symptoms most commonly are fever, 101.5 or over, severe headaches, muscle pains, nausea, vomiting, diarrhea, and then unexpected bleeding or bruising.
Yeah, all of those up until that unexpected,
the last one.
The last one really are common symptoms for being sick.
Yeah. So
right.
A lot of experts are saying they think it's going to be contained. When should we really start taking this seriously? This is an issue that could be threatening us.
Well, the outbreak surveillance is a core public health function, so we are working hard with the state agencies and hospitals in our area to make sure that we identify anybody that may be a potential high-risk case right away.
Okay, so at the beginning of the week we had, I guess you could call it a recent scare with a child up in Delaware, but the CDC decided not to test that child. Why is that?
Right, because they determined the child was not a high-risk person, and really I think no known risk because they had no travel history or exposure history to anybody.
Okay, so this just wasn't one of those. When When is it serious enough that CDC is going to start testing?
Well, they've developed an algorithm for clinicians to use and health departments to use, and following that algorithm, you would determine if the person's been a high risk, low risk, or known exposure. And then based on that, if they've determined to be high risk, then with close contact with state health department and CDC, they would determine whether to test or not, and that would be done on an individual basis.
Okay, so are we doing anything on Delmarva to prepare for Ebola?
We are. In WICOMICO County, the health department is working closely again with the hospitals and clinicians in our community, and with that we can put together policies and procedures on how to handle things. And then regionally also with EMS, they've been given guidance on what they should do and how to prepare. The 911 center has been given guidance on how to handle phone calls that they might get, and the Red Cross has been briefed as well.
So there's procedures of just in case,
Correct.
Exactly what everybody's going to do.
Staying ahead of it.
Olivia Butler, thank you so much for joining us today.
You're welcome. Thank you.
And to read more about what we discussed today and the latest on the Ebola outbreak, go to WVOC.com and click on our picture at the top of the page. Well, many older people want to stay healthy so they can enjoy their retirement years, but a growing number of baby boomers is choosing to stay on the workforce beyond the usual retirement age. Find out why money is not always the reason why.
Perhaps you're looking for a place to retire. Well, you don't have to look any further than right here on Delmarva. We're going to show you why many retirees are choosing to spend their golden years in Sussex County. Delmarva Life. We'll be right back.